Medicare Part A covers inpatient hospital stays, care in a skilled nursing facility, hospice care, and home health services. Enrolling in Medicare Part A. If you receive benefits from Social Security or the Railroad Retirement Board for at least 4 months before your 65th birthday, you will be automatically enrolled in Medicare Part A. If you do not receive benefits from the aforementioned entities, you will need to sign up for Medicare Part A with Social Security. You must enroll in Medicare Part A when you become eligible, or you will face up to a 10% premium penalty increase for late enrollment. Let's go over the costs of Medicare Part A. You won't have to pay a monthly premium for Medicare Part A if you or your spouse paid Medicare taxes for a certain amount of time while working. This is sometimes called premium-free Part A. If you or your spouse are eligible for retirement benefits from either Social Security or the Railroad Retirement Board, you will not have to pay a premium for Medicare Part A. If you do not qualify for premium-free Part A, you'll pay a monthly premium. Let's go over what Medicare Part A covers. Inpatient care. Inpatient care includes care that you get when you're admitted as a patient to a healthcare facility, like a hospital or skilled nursing facility. In order to be considered an inpatient, a doctor has to keep you overnight and formally admit you as such. Inpatient care is covered by Medicare Part A, while outpatient care is covered by Medicare Part B. Medicare Part A covers things like hospital rooms, meals, general nursing or skilled nursing care, and inpatient treatment drugs. It can also cover things like physical therapy or speech-language pathology services if medically necessary, as well as medications and medical supplies. Skilled nursing care. Skilled nursing care can include things like changing sterile dressings, administering intravenous injections, and physical therapy. However, most nursing home care is custodial care, like help with getting in and out of bed, bathing, or dressing. Be aware that Medicare will not cover custodial care unless it is part of another treatment. Hospice care. Hospice care is care for terminally ill individuals who either no longer want to fight their illness, or their doctor has determined that efforts to cure the illness are no longer working. Hospice care addresses many aspects of care, such as medical, emotional, and social needs of the patient, and also provides support to friends and family. Depending on the patient's terminal illness, hospice care can either be given in the home or at an inpatient facility. Home health care. Home health care includes services and supplies that your doctor approves as part of a care plan for your home. This can include things like part-time skilled nursing care and home health aid care, physical therapy, occupational therapy, and other services. Understanding the differences between Medicare Part A and Part B can be confusing. If you would like assistance in navigating your Medicare options, please reach out to us and we'd be happy to help.
MedicareFullest.com is a non-government resource for those who depend on Medicare, providing Medicare information in a simple and straightforward way.